मैम वायरस है नहीं तो क्लीन किसको कराएंगे?
नहीं मेरे Assalamualaikum. I'm Professor Shahida Niazi, and today we are going to start the next lecture of neoplasia, that is lecture number 3. And इसमें काफी सारी चीजें हैं. कल हमने we studied the definition of metastasis, invasion, and we studied in the last lecture, which was yesterday, that metastasis and invasion are the two clinical hallmarks of malignancy. They are the clinical hallmarks of malignancy. और इसके अलावा yesterday we studied the microscopic hallmarks of how we can label a tumor as malignant, and we studied in detail the differences, the gross as well as the light microscopic differences between benign and malignant tumors. Now today we are going to study the mode of spread of cancers. How does cancer spread from one part of the body to another part? What is metastasis, and what is the molecular basis of how invasion and metastasis they occur, and how do they contribute to the growth and the spread of cancers? इसके अलावा what is the process of angiogenesis? ये भी हम आज करेंगे. So metastasis is the unequivocal sign of malignancy. एक दफा किसी ट्यूमर के metastasis हो जाए, it means that it is, for all practical purposes, it is a malignant lesion, it is a cancer. So it is the hallmark of malignancy is metastasis. अब how do we define metastasis? Metastasis की definition है, ये हमने कल I think पढ़ी थी, या maybe I think the slide got skipped. Metastasis is defined as the spread of a tumor to distant site, away from the original site. एक tumor है, उसका suppose ये उसकी original site है. अगर ये इसके साथ एक और पड़ा हुआ है, that is not metastasis. एक ट्यूमर है, उसके साथ ही एक adjacent tissue के अंदर अगर वो ट्यूमर invade कर रहा है, तो that is not metastasis, that is invasion. एक ट्यूमर इधर है और एक उसके suppose कर लो कि एक ट्यूमर इधर है, the primary tumor is here, that is the original tumor. The original tumor is known as the primary. ट्यूमर इधर है, दरमियान में डिजीज फ्री इंटरवल है, कोई बीच में ट्यूमर नहीं है, और समझ लो कि 7 या 8 इंच के फासले पे दूसरा ट्यूमर पड़ा है और वो बाद में डेवलप. सो दैट इज मेटास्टेसिस. जो सेकंड ट्यूमर डिपॉजिट हुआ है, दैट इज द मेटास्टेसिस, एंड दैट इज ऑल. मेटास्टेटिक डिपॉजिट्स आर आल्सो नोन एज सेकेंडरी ट्यूमर्स. So the original tumor is the primary tumor, और जो बाद में डेवलप हुआ और उससे discontinuous है, it is not in continuity. Remember that metastasis always has to be a discontinuous spread. It has to be a discontinuous spread. Continuity नहीं होनी चाहिए. Metastasis और invasion में यही difference है. Metastasis में there should be a free interval, जिसमें के उसके बाद सेकेंडरी डिपॉजिट है. इन्वेजन में बिल्कुल साथ साथ ही, इन्वेजन मींस बेसिकली इट इज लोकल इन्वेजन. लोकल इन्वेजन होती है इर्द गिर्द, बिल्कुल उसी जगह, उसके साथ एडजेसेंट नेबरिंग टिश्यू में, और मेटास्टेसिस होती है टू सम फार फ्लंग एरिया, जो कि उसके साथ इन कंटिन्यूटी नहीं है, ठीक है। So local spread or invasion is in continuity. It is spread into the adjacent tissues or the neighboring tissues, whereas metastasis is a discontinuous deposit of the tumor. So we define metastasis as spread of a tumor to distant site that is physically discontinuous and away from the primary tumor, which is the original. And this is the hallmark that labels and marks a tumor as malignant. The primary tumor, जो कि original tumor था, that is the primary tumor, और जो बाद में जो उसका metastatic deposit है, that is the second. अब कुछ tumors होते हैं जो कि कोई metastasis नहीं produce करते, कुछ malignant tumors होते हैं जो कि metastasis नहीं produce करते, and the classical example of those two tumors is basal cell carcinoma, which is a tumor of the skin. Face पे बहुत commonly develop करते हैं basal cell carcinomas. इसको हम कहते हैं, ये locally invade करता है लेकिन distance metastasis नहीं produce करता, इसको हम rodent ulcer भी कहते हैं। rodents होते हैं ना, ये जो हमारे चूहे वगैरह होते हैं, ये अंदर ही अंदर घुसते हैं ना नीचे की तरफ, बिलों में जाते हैं। basal cell carcinoma does not produce distant metastasis, it does produce local invasion. इसी तरह another example is that of the glial tumors, that is the brain tumors. Brain tumors इर्द गिर्द as such नहीं जाते, metastasis नहीं produce करते, लेकिन उनका एक phenomena है जिसको हम कहते हैं skip metastasis, वो अभी हम आज करेंगे। So what are the pathways of spread of tumors, which is known as how do cancers they spread? Number one is direct seeding of the body cavities of surfaces, यानी कि direct spread है, एक ट्यूमर साथ ही दूसरी जगह पे spread हो रहा है, that is direct spread, और आमतौर पे ट्यूमर spread करते हैं into the peritoneal cavity. जो abdominal के ट्यूमर्स होंगे वो पेरिटोनियल कैविटी में स्प्रेड करेंगे, और जो लंग कैंसर और जो ब्रेस्ट कैंसर दे यूजुअली गो टू द प्लूरल कैविटीज. Then we have lymphatic spread. Then we have hematogenous. Lymphatic spread is via the lymphatic channels. Hematogenous spread means via the bloodstream. And iatrogenic spread is that type of spread which has been जो कि हम प्रोड्यूस कर रहे हैं as a result of our negligence. यानी कि हमने suppose एक ट्यूमर को हमने एक्साइज करने की कोशिश की है, या हमने उस ट्यूमर के अंदर हमने नीडल डाल दिया, तो उस नीडल ट्रैक के अंदर हमसे वो जो नीडल ट्रैक का जो पाथवे था उसके अंदर अगर ट्यूमर डेवलप हो जाए, हाइड्रोजेनिक मींस के व्हिच वी हैव क्रिएटेड एज अ रिजल्ट ऑफ सर्जिकल मैनिपुलेशन, या हमसे खुद से हो गया. Iatrogenic means implantation of tumor cells on surgical instruments during biopsies and surgical manipulation or during fine needle aspiration procedures. For example, a needle track spread in cases of testicular biopsies. तो testis की हम कभी भी biopsy नहीं लेते, because जब हम अंदर नाइफ डालते हैं या जब अगर हम कुछ करने लगते हैं, so it spreads via the surgical path. So that's why testicular biopsies are always contraindicated. Then we have ये ऊपर पहला वाला था direct seeding of the body cavities of surfaces. ये जो fifth है, that is direct spread as a result of contact. For example, cancer of the upper lip can spread to cancer of the opposing lower lip, क्योंकि दोनों आपस में contact में आ रहे हैं, और vice versa due to direct contact. So these are the 5 methods of how cancers can spread or disseminate. We have just studied why biopsy from a testicular mass is avoided because of hydrogen spread. तो हम बायोप्सी को अवॉइड कर लेते हैं ताकि हमारे इंस्ट्रूमेंट्स की वजह से या हमारी किसी नेग्लिजेंस की वजह से स्प्रेड ना हो।
मैम
जी जी
मैम आपकी आवाज बिल्कुल ठीक नहीं आ रही, ब्रेक होकर आ रही है।
बेटा आई थिंक देयर इज सम प्रॉब्लम इन द नेटवर्क। बेटा क्या ये पूरा देखो, वो कह रहे हैं हमें आवाज नहीं आ। I think there's a problem in the network.
सिर्फ एक स्टूडेंट को नहीं आ रही है, सबको नहीं आ रही।
हम मुझे भी नहीं आ रही।
हाँ बेटा बच्चों प्लीज,
काफी ब्रेक करिए, आवाज
सबको नहीं आ रही है।
बिल्कुल भी नहीं आ रही, सबको नहीं आ रही या एक आधे बच्चे को नहीं आ रही?
मैम नहीं आ रही।
सबको नहीं आ रही।
मैम सेंटेंस की समझ नहीं आ
बेटा
सबको ही नहीं
आपकी
आ
तो
रही
आवाज
मैम।
मुझे आ रही है।
मैम सबको ही नहीं आ रही।
हाँ जी
मैम
मैम
हमारा
सबको ही
रही।
नहीं आ रही।
नहीं आ रही।
कुछ समझ आ रहा है कि नहीं आ रहा जो मैं पढ़ा रही हूँ?
नहीं आ रहा।
नहीं आ
मैम
रहा,
नहीं
क्यों
आ
नहीं आ रहा? आवाज की वजह से नहीं आ रहा है या वैसे मुश्किल लग रहा है?
मैम आवाज की वजह से कुछ समझ ही नहीं आ
आवाज
रहा
की
आप क्या
वजह से।
बोल।
फिर अब
मैम
बताओ क्या
आवाज
करें?
नहीं आ रही।
आपको मेरी स्लाइड प्रोजेक्शन तो नजर आ रही है ना? हेलो गाइस,
यस
यस
मैम।
मैम।
स्लाइड प्रोजेक्शन तो नजर आ रही है ना?
यस मैम स्टार्ट है।
यस मैम।
वो तो नजर आ रही है ना स्लाइड?
यस
टेक्स्ट नजर आ रहा है बच्चों?
मैम।
यस
Yes,
मैम
ma'am.
स्लाइड आ रही है।
बेटा मेरे सवाल का जवाब तो आप लोग दे रहे हो, इट मीन्स कि आवाज आ रही है ना?
मैम आवाज आ रही है लेकिन ब्रेक कर
अब
रही
आ
है।
रही है, पहले नहीं आ रही थी।
अच्छा चलो अब देखते हैं। So we start with the 5 methods of spread जो अभी हमने करे थे। Number 1 was direct seeding or penetration of the body cavities or surfaces. ठीक है? Malignant tumors यानी कि जो cancers है, they can penetrate, they can invade the body cavities and surfaces through a natural open field which lacks a physical barrier, and that process of penetrating into a body cavity is known as seeding. उसको एक खास नाम दिया हुआ है, that is penetration of a tumor cell into a body cavity, and that is called seeding. The most common body cavity which is involved mainly from the abdominal organs is the peritoneal cavity, like cancer of the ovary, cancer of the appendix, cancer of the colon. They spread their malignant cells into the peritoneal cavity. Peritoneal fluid के अंदर अपने cells फेंक देते हैं, ठीक है? अब इसी तरह हमारी बॉडी कैविटीज कौन कौन सी है? एक हमारी प्लूरल कैविटी है, हमारी पेरिटोनियल कैविटी है, हमारी पेरिकार्डियल कैविटी है, हमारा ब्रेन के अंदर सब एरेक्नोइड स्पेस है, हमारी साइनोवियल कैविटीज हैं जॉइंट्स के अंदर। सो प्लूरल कैविटी is involved, pleural cavity and the pericardial cavity, they are mainly involved in cancers of the breast and cancers of the bronchus, because cancer of the bronchus and cancer of the breast, जाहिर बात है वो बिल्कुल प्लूरा के पास है ना, डायफ्राम सेपरेट कर रहा है हमारा चेस्ट कैविटी को फ्रॉम द एब्डोमिनल कैविटी। एब्डोमिनल कैविटी के जितनी भी malignancies होंगी, they are going to spread to the peritoneal cavity, and thoracic cavity की जितनी भी malignancies होंगी, they are going to spread to the pleural cavity and the pericardium. Now what is pseudomixoma peritoni? Now this is a very important terminology. ये बहुत important term है and it is usually asked in the viva. Now this is a clinical term. It is a clinical term in which certain mucinous carcinomas. Mucinous carcinomas are those cancers which produce mucin. They produce certain mucus substances like appendiceal cancers, like cancer of the appendix, and mucinous cancers of the ovary, malignant mucinous cancers of the ovary. They produce mucin, and that mucin, that coats the cavity of the peritoneum. पूरा का पूरा peritoneal cavity gets filled with a jelly-like material, a sticky jelly-like material, and that उस jelly-like material को जब भी abdomen आप खोलो तो पूरा का पूरा abdomen is filled with a mucinous jelly-like sticky substance, and if you examine that sticky substance under the light microscope, आप उसका मटेरियल लेके स्लाइड बना के अंडर द माइक्रोस्कोप देखो, it is full of malignant cells, and that condition is known as Pseudomixoma peritoni. It is a clinical condition in which certain mucin secreting cancers of the appendix and cancers of the ovary, they fill the peritoneal cavity with a heavy layer of gelatinous cancerous glaze. And these cancer cells, this jelly-like material, yeah, abdominal viscera के अंदर नहीं penetrate करती. It does not penetrate or invade into the substance of the abdominal viscera, but it just उनके ऊपर एक layer या एक superficial सा coat बना देती. ठीक है, समझ आ रही है? What is Pseudomixoma peritoni? Hello बच्चों, समझ आई है?
Yes, ma'am.
आवाज आ रही है आप?
Yes, ma'am.
अच्छा अच्छा. The second important term which you should know is the Krukenberg. Now Krukenberg tumors, they are invariably bilateral. Bilateral means दोनों तरफ होंगे, and they are bilateral ovarian metastatic deposits. Bilateral ovarian tumors हैं and they are metastatic deposits. ये ओवरी के अंदर metastatic deposits हैं from cancer of the breast or from cancer of the stomach. Cancer of the stomach and cancer of the breast, they are notorious for producing distant mets, और इनके आमतौर पे distant metastatic deposits जा रहे हैं to both the ovaries, and those ovarian tumors, bilateral ovarian tumors which are of metastatic origin, they are known as Krukenberg tumor. And on light microscopic examination, आप इन ट्यूमर्स को जब एग्जामिन करो तो इनके अंदर हमारे एम्प्टी वैक्यूलेटेड से सेल्स होते हैं जिनको हम कहते हैं सिग्नेट रिंग सेल्स. जैसे अंगूठी होती है ना, अंगूठी में एक सेंटर होता है, खाली सेंटर होता है, और उसका जो स्टोन होता है वो आमतौर पे जाहिरी बात है एक अंगूठी जो उसका एक स्टोन होता है वो पेरिफेरी की तरफ होता है. जैसे हमारे फैट सेल्स होते हैं, दे आर आल्सो सिग्नेट अपियरिंग सेल्स. जो न्यूक्लियस होता है वो पेरिफेरी की तरफ चला जाता है. So signet ring cells are the hallmark, microscopic hallmark of Krukenberg. Now this is, ये हमारा यूट्रस है, ये उसका सर्विक्स. अब ये जो दोनों साइडों पे ये जो बड़े बड़े व्हाइट कलर के ट्यूमर्स हैं, these are metastatic deposits from either carcinoma breast or from और कहाँ से और from cancer of the stomach. ये देखो bilateral है, ये ovaries, ये भी ovary है और ये भी ovary, but they are not normal. They have harbored metastatic deposits from cancer of the stomach or from cancer of the breast, and these are known as Krukenberg. So they are bilateral metastatic deposits to the ovaries. Now this is a light microscopic image. ये आप appreciate कर रहे हो कि these are empty cells और जो इनका nucleus है that has been pushed to the periphery, and these are known as signet ring cells. Krukenberg tumor हम तभी कहेंगे अगर it is grossly a bilateral ovarian tumor and on microscopic examination it is composed up of these empty vacuolated cells which are known as signet ring cells. समझ आ रही है Krukenberg tumor की? बच्चों बोलो.
Yes, ma'am.
समझ आ गई है? Pseudomixoma peritoni की समझ आ गई है?
Yes, ma'am.
फ्रूकेनबर्ग ट्यूमर की समझ आ गई है?
Yes, ma'am.
एक ही बच्ची बोलती है यस मैम, और तो पूरी क्लास सो रही है।
यस मैम आ गई है।
बॉयज किधर हैं? बॉयज, फरूख आपको समझ आई है? रोल नंबर 23067, अब्दुल मुईद, फिजान।
यस मैम।
अब
यस मैम।
फिजान हो?
यस मैम।
अच्छा, आपको समझ आ रही है ना बेटा?
जी मैम।
अच्छा, चलो गुड। Now we come on to the second method of spread, and that is spread along the epithelial line surfaces, that is spread via direct continuity. अब ये बड़ा सिंपल सा है, इसमें कोई बहुत बड़ी वो समझने वाली बात है। जैसे एंडोमेट्रियल कैंसर है, कैंसर ऑफ द यूट्राइन कैविटी, यूट्रस का कैंसर होता है, उसको हम कहते हैं एंडोमेट्रियल कैंसर। वो वाया यूट्रस में, आपको पता है ना कि यूट्रस के आप लोगों ने डाइसेक्शंस की हुई, आपने तस्वीरें देखी हुई, उनमें फिलोपियन ट्यूब्स होती हैं। फिलोपियन ट्यूब्स जाती हैं ओवर द ओवरीज, उनके फिम्ब्रिएटेड एंड्स होते हैं, वो ओवरीज के ऊपर होती हैं। सो एंडोमेट्रियल कैंसर कैन स्प्रेड वाया द फिलोपियन ट्यूब्स के चैनल्स के साथ ट्रेवल करके, इट कैन स्प्रेड टू द ओवरीज। ठीक है, ओवरीज के ऊपर चला जाएगा, डायरेक्ट स्प्रेड हो रहा है अलोंग एपिथेलियल लाइन सर्फेस। इसके अलावा ओवरी का अगर ट्यूमर है तो वो वाया द फिम्ब्रिएटेड एंड ट्रेवल करेगा वाया द फिलोपियन ट्यूब और एंडोमेट्रियम के अंदर चला जाएगा। सो एंडोमेट्रियल कैंसर traveling via the fallopian tubes can produce its spread into the ovaries, and ovaries का tumor can spread via the fallopian tubes and invade the endometrial cavity. इसके अलावा endometrial cancer नीचे से it can spread directly into the cervix. ठीक है, ट्रायंगुलर शेप एंडोमेट्रियल कैविटी है, उसके अंदर अगर ट्यूमर है तो डायरेक्टली नीचे सर्विक्स है, तो डायरेक्टली इट कैन इन्वेड इनटू द सर्विक्स। अब ब्रोंकोजेनिक कैंसर है, यानी कि लंग का कैंसर है, तो इट इज गोइंग टू स्प्रेड वाया द ब्रोंकाई, bronchioles, and then into the terminal alveolar spaces, which are the alveoli. So cancer of the lung can spread distally into the alveolar space. इसी तरह किडनी का अगर कैंसर है, कैंसर ऑफ द किडनी, it can spread via the ureters into the urine. So these are examples of direct spread, direct continuity. Then we have spread along the cerebrospinal fluid. This is also a type of direct spread. Now malignant brain tumors, अभी हमने अभी बताया था कि आमतौर पर जो malignant brain tumors हैं, they do not produce metastatic deposits. But if there is a malignant brain tumor of the ependymoma, ependymal linings, or ependymal linings, as you all know that they are the linings of the ventricles. If there is a tumor, ependymomas, which are mainly tumors which are present in the ventricles of the brain. हमारे lateral ventricles हैं, हमारा fourth ventricle है, हमारा third ventricle. If we have ependymal tumors which are present in the ventricles of the brain, via the ventricles के अंदर हमारे होता है CSF fluid, and this CSF fluid of the ventricles is in direct continuity with the CSF which lines the spinal cord, and then brain का जो हमारे ventricles की जो fluid है, it travels via the CSF of the spinal cord, और नीचे की तरफ via gravity it travels downwards, and it drops downwards via the spinal root, and this is known as drop metastasis. क्योंकि ये drop कर रहा है from the brain, ventricles of the brain, directly downwards along the spinal column, the CSF which is lining the spinal cord, it spreads downwards. वही हमारे CSF जो brain का होता है, the same CSF is surrounding the spinal cord and it spreads downwards. These are known as drop metastasis. समझ आ रही है बच्चों? समझ आ रही है?
Yes, ma'am.
Chalo, good. Then we have the fourth method of spread is the lymphatic spread. In the past, the time-honored statement was that
Yes, ma'am.
the carcinomas, they spread via the lymphatic pathways, and the sarcomas, they spread via the hematogenous pathway. Carcinomas are malignant tumors of epithelial origin, and sarcomas are malignant tumors of mesenchymal origin. But this statement has been, that has not been considered to be correct now. And generally speaking, पहले ये कहते थे कि the most common and the most important pathway for the initial dissemination of cancers was the lymphatic pathway, whereas the sarcomas, they choose to spread via the hematogenous pathway. But both mechanisms can occur in carcinomas and sarcomas, that is, both can spread via the lymphatic pathways and they can also spread via the hematogenous pathway. So what is the role of lymph nodes in cancer spread? This comes under the heading of lymphatic spread. The pattern of lymph node involvement, that is spread into the lymph nodes, it follows the natural routes of lymphatic drainage. For example, cancer of the breast involving the upper outer quadrant of the breast, it is going to invade the axillary lymph nodes. Cancers of the inner quadrants of the breast, हम breast को 4 quadrants में divide करते हैं ना, upper outer quadrant, upper inner quadrant, lower outer quadrant and lower inner quadrant. So cancers of the upper outer quadrants, they spread to the axillary lymph nodes, and cancers of both the inner quadrants, upper inner quadrant and the lower inner quadrants, they spread along the lymph nodes which are situated along the internal mammary chain, and these can later on involve the infraclavicular lymph nodes and the supraclavicular lymph nodes. So cancer of the breast can spread to the axillary lymph nodes. It can spread along the lymph nodes along the internal mammary chain. It can involve the infraclavicular lymph nodes, and they can involve the supraclavicular lymph nodes depending upon where the location of the tumor is in the breast. 4 quadrants में से जहां पर. Cancer of the lung most commonly produces its metastatic lymphatic spread to first to the perihilar tracheobronchial lymph nodes and the mediastinal lymph nodes. जो कि सबसे करीब lymph nodes होते हैं, पहले उधर जाते हैं. Now what are skip mets? Skip metastases are, sometimes it so happens that the local lymph nodes, they are bypassed. उनको skip कर जाते हैं और कोई और lymph node का जो एक और lymph node का system है, it gets involved. Local lymph nodes may be bypassed because of obstruction of the channels by inflammation or radiation, and another lymph node group which is not the local lymphatic group, it is involved. That is known as skip mets. थोड़ा सा परे करके जा. आमतौर पे cancer of the breast produces its deposits lymphatic spread to the axillary lymph nodes. Cancer of the thyroid produces its metastatic deposits to the cervical lymph nodes. Cancer of the lung produces its deposits in the hilar and the paratracheal lymph nodes. Cancer of the lung and the oral cavity also produces its deposits in the cervical lymph nodes. For all practical purposes, head and neck के जितने भी cancers होंगे, head and neck के, वो cervical lymph nodes. ठीक है? Cancer of the lung and oral cavity, cervical lymph nodes. Testicular cancer is going to spread to the para-aortic retroperitoneal lymph nodes. prostatic cancer is also going to spread to the para-aortic nodes and to the vertebral bodies. जो हमारे vertebra होते हैं उनकी bones के अंदर चला जाता है. Now, involvement of the regional lymph nodes by cancer deposits is known as regional node metastasis, and if the distant lymph nodes in a body or distant organ involvement occurs, these are known as distant metastasis. So regional metastasis करीब वाले metastatic deposits होते हैं, और अगर दूर वाले हो जाएं तो they are known as distant metastasis. Now sometimes due to obstruction of the lymphatics as a result of clogging by the tumor cells or fibrosis, the lymphatic flow, एक channel में एक तरफ अगर lymphatic flow जा रही है unidirectional, that gets disturbed, and the tumor cells, they start spreading against the flow of lymph, which is known as the retrograde spread. So in that cases, deposits of cancer or metastatic deposits of certain cancers, they go to certain unusual sites. For example, cancer of the prostate. Prostate तो नीचे pelvic cavity में located है, तो उसके metastatic deposits हमारे supraclavicular lymph nodes में, neck के lymph nodes में चले जाते हैं. And similarly, metastatic deposits of cancer of the lungs, उनको आमतौर पे अपने करीब वाले lymphatic group में जाना चाहिए, lymph nodes के group में, that is cancer of the lungs to go to the perihilar lymph nodes, लेकिन cancer of the lung के if they go to the axillary lymph nodes or the cervical lymph nodes. So these are known as retrograde type of spread. Now what is a varicose lymph node? Varicose lymph node is a left supraclavicular lymph node, enlarged left supraclavicular lymph node, which contains metastatic deposits from cancer of the stomach, cancer of the pancreas, cancer from the colon, and colon cancer, and cancer from the gallbladder. Now that is known. इसको आपको पता होना चाहिए कि varicose node क्या है. This can also be asked in the Bible. It is a left supraclavicular lymph node which is harboring metastatic deposits, most commonly from cancer of the stomach, cancer of the gallbladder, pancreas, or colon. ठीक है? That is varicose. Now, what is a Sister-Mary-Joseph node? It is a umbilical nodule. Umbilicus के गिर्द एक nodule होता है, and it is basically a metastatic deposit from cancer of the colon. Now, why is it named as Sister-Mary-Joseph node? Now, it's an old story that there was a nun. उसका नाम था Sister Mary Joseph, and she was a nurse. She was looking after surgical patients who were suffering from ward के अंदर colon cancer के बहुत सारे patients. And this nun, she was looking after those patients, and she made the startling observation that वो उन patients की dressing करती होती थी, cancer of the colon के patients की जो जिनकी surgery हो गई होती थी. And she made the observation कि बहुत सारे cancer patients हैं, colon cancer patients हैं, जिनके umbilicus के ऊपर nodules बन जाते हैं. और जब उन nodules की biopsy surgeons ने की, तो they found that cancer of the colon, they have produced their metastatic deposits around the umbilicus. So उसके बाद उस जगह umbilical nodules को ये नाम पड़ गया, Sister Mary Joseph node, which is an umbilical nodule. It is a metastatic nodule from cancer of the colon. समझ आ गई है?
Yes, ma'am.
Yes, ma'am.
समझ आ गई?
Yes, ma'am.
आवाज आ
ma'am.
रही है?
Yes, ma'am.
उस्वा, हमजा, आप लोगों को आवाज आ रही है? समझ आ रही है? बोलो बच्चों.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
अच्छा चलो गुड. जहां ना समझ आए you can stop me, I can repeat it. Now what is the sentinel lymph? Sentinel lymph node is the first lymph node in a regional lymphatic group that receives lymph flow from the primary. और सेंटिनल लिम्फ नोड के बहुत इंपॉर्टेंट पॉइंट ये है कि इसको ढूंढना बहुत जरूरी होता है. इसकी मैपिंग करते हैं by injecting certain radio labeled tracers or dyes, and then we take out that lymph node surgically, and then you examine it with the help of a frozen section. Frozen section होता है ये जब हम diagnosis lab diagnosis of cancer करेंगे तब we will study in detail what frozen section is, but briefly frozen section is a rapid method of histological examination. It is a rapid fast forward method of histological examination in which you examine that tissue immediately as soon as it is removed from the body, while the patient is under anesthesia and the patient is on the operation table. उसी वक्त उसका कोई टिश्यू हम निकाल के उसको फ्रीज करके रैपिड प्रोसेसिंग करके we see it under the microscope, and then we guide the surgeon कि अब आपने क्या करना है. If radical surgery की जरूरत है या the patient can be closed, the whole of the tumor has been. ठीक है, that is what we mean by the term frozen section. So sentinel lymph node, when it has been mapped with the help of radio tracer dyes or blue dyes, so that is taken out and it is examined. In cancer of the breast, the most important prognostic factor is determination of the axillary lymph node status. And the first axillary lymph node which is involved, the lowermost axillary lymph node which is involved, is known as the sentinel lymph node. That is the first lymph node that is involved. अगर वो involved है तो it means that the remaining of the lymph nodes are also going to be involved. The axilla के अंदर आपको पता है ना, कोई 20-30 lymph nodes होते हैं. Sentinel lymph node तो एक ही lymph node होता है. If that sentinel lymph node is involved, which is the first lymph node in the regional lymphatic basin, if that is involved, it means the distal lymph nodes are also all going to be involved. If the sentinel lymph node is not involved, it means the remaining of the distal lymph nodes are also not going to be involved. So you can safely tell the surgeon uski dissection uska cancer breast completely remove ho gaya, there are no axillary metastatic deposits, you can close the patient. While the patient is on the operation table, sentinel lymph node ki biopsy report usi waqt de. And the importance is that you can easily plan further surgery and treatment protocols. You have to guide the surgeon. अगर sentinel lymph node involved है, तो surgeon ने radical mastectomy भी करेगा. Mastectomy is the removal of the breast. जब हम cancer of the breast के लिए जब हम breast को remove करते हैं, that procedure is known as mastectomy. M-A-S-T-E-C-T-O-M. That is known as mastectomy. और अगर हमने lymph nodes भी निकाल दिए हैं तो हम कहते हैं कि this is radical mastectomy with axillary lymph node clearance. जब हमने lymph nodes भी निकाल दिए हैं तो that is mastectomy with axillary clearance. समझ आ रही है बच्चों? बच्चों, क्लास?
मैम आपकी आवाज नहीं आ रही.
No response, no response, please. And sentinel lymph node biopsy assumes importance in cases of cancer of the breast as well as in colon cancers and malignant melanoma, which is a skin cancer. ठीक है? Sentinel lymph node is very important. इसको अपनी किताब में से पढ़ भी लो बच्चों. What is the function of the lymph nodes in the immediate vicinity of malignant tumors? Number one, they act as the first physical barrier filter to prevent the further spread of malignant cells. Number two, they cause destruction of the tumor cells. जाहिर बात है, they are the major component of the immune system. So initially, they are also going to act as a first physical barrier. Number two, they are going to cause destruction of the tumor cells by the T cell. And later on, जब इनके ये दोनों functions compromise हो जाएंगे, they are going to provide a fertile soil for the growth of cancer cells. If there is enlargement of the regional lymph node, that does not mean अगर कैंसर ब्रेस्ट का है और उसका रीजनल लिम्फ नोड, एक्सिलरी लिम्फ नोड एनलार्ज्ड है, इसका ये मतलब नहीं है इनवेरिएबली दैट इट हैज बीन इन्वॉल्व्ड, इसमें भी कैंसर है कि दैट इट हैज बीन इन्वॉल्व्ड इन अ मेटास्टैटिक डिपॉजिट. समटाइम्स द रीजनल लिम्फ नोड्स, they because they are trying to control the spread of the tumor, they get enlarged as a reactionary process, and that is known as reactive hyperplasia, that is reactive enlargement of the lymph node, or sinus histiocytosis, or reactive lymphadenitis as a reaction to the necrotic products of tumor and the antigens that have been produced. Now, hematogenous spread is spread via the bloodstream. That is the fifth most common method of spread of cancer. And this usually occurs via the veins because they have thin walls which can easily permit the penetration by cancer cells. Arteries are less liable to get involved because they have thick muscular walls and elastic tissue, which is not easily penetrated by the malignant cells. But arterial spread definitely does occur. And in the past, it was said that hematogenous spread was the most common route of spread of sarcomas, and lymphatic spread was the most common route of spread of carcinomas. लेकिन ये अब बहुत hard and fast rule नहीं है. Now then there are certain cancers which have a particular affinity to spread via the veins. They have a propensity to invade the walls of the veins. For example, renal cell carcinoma, kidney cancer. It has a particular affinity to invade the branches of the renal vein. छोटी branches के अंदर घुस जाती हैं cancer cells. छोटी branches drain करती हैं into the main renal vein, and फिर into the main renal vein, the tumor cells grows in the lumen of the main renal vein. उसके lumen के अंदर grow करेगी as a continuous snake like. उसकी लाइनिंग को फॉलो करते करते जितना उसकी आउटलाइन होती है रीनल वेन की, उसी तरह उसको एक वर्म की तरह फॉलो करती जाती है, एंड देन दैट कॉलम ऑफ मैलिग्नेंट सेल्स इट एंटर्स इनटू द इंफीरियर वेना केवा. रीनल वेन अल्टीमेटली ड्रेन करेगी इनटू द इंफीरियर वेना केवा, एंड द इंफीरियर वेना केवा देन एंटर्स इनटू द राइट साइड ऑफ द हार्ट. सो रीनल सेल कैंसर directly via the renal vein, via the inferior vena cava, it reaches the right side of the heart. Similarly, hepatocellular cancer, which is a cancer of the liver, malignant cells, they penetrate into the portal and the hepatic vein radicals, and then they also enter into the right side of the heart. ये भी फिर वेना केवा में जाएंगे, and then they grow into the main channels. जितने भी blood borne metastases होते हैं, they are usually multiple, rounded nodules of various sizes, and they are scattered throughout the whole organ. ये कल मैंने आप लोगों को yesterday एक तस्वीर दिखाई. This was the liver. This is the liver, और उसके अंदर आप देखो कितने सारे metastatic deposits हैं. Variable sizes, multiple deposits. बेटा कर्सर नहीं आ रहा. इमरान, अदनान, इमरान, ये देखो कर्सर नहीं आ रहा. Sometimes it so happens that the primary tumor cannot be detected, and the metastatic deposits, they come to attention before the primary. जब आप मेटास्टैटिक डिपॉजिट्स की बायोप्सी करते हो तो यू सी कि इसके अंदर ट्यूमर है, लेकिन ये कहाँ से आया, यू कैन नॉट. So sometimes the metastatic deposits, they come to attention before the primary tumor is detected, and then it becomes a hassle to detect where was the primary. And the metastatic deposits sometimes, जैसे primary tumor was trying to spread to the body via different methods of spread, similarly the metastatic deposits in turn, they also try to spread further dissemination, they try to spread further, they try to cause further dissemination of the tumor via the lymphatics and the blood vessels. That is the primary tumor to kar hi raha hai spread. Now the metastatic deposits, they are also trying to take the same pathways, mainly the lymphatics and the blood vessels to spread. And the metastatic deposits, they generally, if you examine them histologically, they generally try to reproduce the original histological structure of the original primary tumor. But they may show varying degrees of differentiation. They may become poorly differentiated, they may become undifferentiated. But usually they try, generally speaking, they try to maintain the original histological structure of the primary. For example, hepatocellular carcinoma in a metastatic site, it will try to maintain the sinusoidal pattern of growth. Sinusoidal pattern of growth, and the hepatic cells, they are arranged in well-formed hepatic cords. उसका दरमियान में sinusoidal pattern हो जाता है. And in fact, because they tend to produce bile के भी आपको plugs मिल जाते हैं. So that becomes a useful clue. It becomes a useful clue to diagnose that this metastatic site is from the original site was the hepatocellular. Similarly, the classical renal cell carcinoma. The classical pattern of renal cell carcinoma is that iske andar we find large clear cells. It is basically a clear cell tumor. Cytoplasm is all clear and the nucleus is in the center. And number two, the vascular network is also a very prominent vascular network. Choti arc-like blood vessels. So clear cells and arc-like blood vessels. The metastatic deposit is going to recapitulate the original pattern of renal cell carcinoma. And in that case, it becomes very easy for you to say that this is a metastatic deposit from a renal cell carcinoma. If आपको primary tumor का नहीं पता कि ये कहाँ से आया है, the metastatic deposit has been the first site of detection. In that case, when you examine the metastatic deposit, you can easily say that it has clear cells, it has a fine vascular network, so it means most likely it is a metastatic deposit from a renal cell carcinoma. Or in case of hepatocellular carcinoma, you find bile plugs. And the organs which are notorious for harboring metastatic deposits are the liver, the lungs, the brain, the bones, the kidney, and the adrenals. And these sites, the liver, the lungs, stars dale mein liver and lungs are very common sites. They provide a good fertile soil for the growth of malignant cells. Liver and lungs are the most favored sites of hematogenous spread of cancers because the whole of the portal area, gut ka jitna bhi hai and pancreas, it flows to the liver, and all the caval blood. Portal area goes to the liver and all the caval blood goes to the lungs. So liver and lungs are the most favored sites of blood-borne metastasis. CA colon, cancer of the colon preferably produces its mets first to the liver. Cancer of the lung produces bronchogenic cancer. It produces metastatic deposits to the adrenals and to the bones, brain, and kidney. Organs which do not allow tumors to grow, they do not harbor metastatic deposits. They are the spleen, the heart, and the skeletal muscle. Spleen में इसलिए नहीं जाता because it is an unfavorable site for metastatic deposits because it has an open sinusoidal pattern, and that open sinusoidal pattern, it does not permit the blood flow. What rapidly the blood flows through the spleen, and it does not permit the tumor cells to stay over there for longer period of time to grow and multiply and produce their metastatic deposits. So hematogenous spread occurs via the veins. Ye humne kar liya hai. Now what is invasion and metastasis? That is the hallmark of malignant. Invasion is the ability to invade or infiltrate the adjacent tissues, neighboring tissues. And metastasis is the ability to invade far-flung areas of the body, which is the hallmark of malignancy. And they are the major causes of cancer-related morbidity and mortality. And this invasion and metastasis is due to a complex interaction between the stroma and the cancer cells. Now, how does metastasis occur? There are two methods of or two processes take place. There are two phases in the metastatic cascade. Number one is that the tumor cells, they tend to invade the extracellular matrix, that is their supporting stroma. And the supporting stroma comprises of the interstitial connective tissue and the basement. And each of these components, that is the interstitial connective tissue and the basement membrane, they are composed of collagen type 4, proteoglycans, glycoproteins, and this invasion of the extracellular matrix, invasion by the tumor cells of the extracellular matrix, it occurs in 4 phases, which we will just discuss. And number 2 phase of the metastatic process is the spread into the bloodstream. How does it enter the vascular channels? How does it grow within the vascular channels? How does it home? They create their residences in the vascular channels, and then they colonize over there. So number 1 is the first step of invasion. Invasion is an active process. It is an active process, and it is the first process which initiates the metastatic cascade. The first step in metastasis is invasion of the extracellular matrix. This is the initial step, the first step or the initial step, and it is an active process. And it occurs in 4 steps. Number 1 is the loosening up of the adhesion molecules. That is the cell-to-cell contact between the adjacent cells that is broken. तभी सेल स्प्रेड करेंगे ना, अगर आपस में चिपटे में तो फिर तो वो नहीं स्प्रेड करेंगे. So number 1 process is that there is loosening up of the intercellular attachments of one cell with the other. Number 2 is the degradation of the extracellular matrix, which is brought about by the matrix metalloproteinases, the proteases, the collagenases. Matrix metalloproteinases, which are the enzymes which try to digest the proteolytic enzymes. Then these malignant cells, which have been loosened up, which have degraded the extracellular matrix, they come and they attach to the modified extracellular matrix components which have been degraded. उनके साथ attach करेंगे, and then they migrate out and they invade the blood vessels. So the number 1 is that there is loosening of the intercellular adhesion molecules. We studied yesterday that one of the most important adhesion molecule which facilitates the spread of cancer is lack of weak adherent. Normally, normal healthy cells, not cancerous cells, they are held together with the help of adhesion molecules or sticky glues with the help of weak adherent. Weak adherent is an adhesion molecule, calcium dependent adhesion molecule. It holds the epithelial cells together, and it also holds the epithelial cells to the underlying basement membrane. जब underlying basement membrane टूट जाती है तो cancer cell invasive हो जाता है ना, हमने in situ और invasion पढ़ी थी ना. Loss of adhesion molecules, it reduces the ability of the cells to glue or stick to one another, and thus it facilitates the detachment from the primary. So loss of weak adherent adhesion molecule is very commonly seen in cancer of the breast, cancer of the stomach, and cancer of the colon. The 2 most common cancers. Number two is that there is degradation of the extracellular matrix, and that is brought about by the proteolytic enzymes, which include the matrix metalloproteinases and the cathepsins. These enzymes, they remodel and they degrade the extracellular matrix, they degrade the basement membrane, and they also help to release certain growth factors. Then the third process is that these tumor cells, जिनके adhesion molecules आपस में टूटे थे, there is attachment of these tumor cells to the degraded extracellular matrix. And the cancer cells have altered receptors. Cancer cells themselves, they try to degrade or modify the extracellular matrix by producing matrix metalloproteinases 2 and matrix metalloproteinase 9, which allows the attachment and invasion of the tumor cell to the extracellular matrix. And then the fifth and the most important point is now the final step of invasion is locomotion or migration. Tumor cells, they are channeled. They start migrating, they start moving through the degraded and the modified basement membrane. अब इससे ये migrate कर, and they are now going to enter into, they are going to break the wall of a blood vessel and enter into a blood vessel. So the process of invasion is a multi-step process. इसके 4 main processes हैं. Number 1 is loosening up of the cell-to-cell contacts, that is loosening up of the adhesion molecules. Number 2 is degradation of the extracellular matrix by the matrix metalloproteinases. Number 3 is attachment of the tumor cells to the modified extracellular matrix, and then there is migration of the tumor cells through this modified extracellular matrix. So the process of invasion has 4 steps. It is a multi-step process. It involves many receptors, signaling molecules, cytokines, chemokines, growth factors, motility factors. In fact, certain stromal cells like the inflammatory cells, the immune cells, B cells, T cells, inflammatory cells, fibroblasts, they all play a very integrated manner. They all play a very important role in the process of migration, invasion, and spread of malignant. So the second major process is Pella process, the invasion. Now this is how the tumor cells are invading into the blood. The Pella process was invasion, and it comprised of 4 main steps. Now this is vascular dissemination, that how are the tumor cells entering into the blood vessel. After traveling through the extracellular matrix, the tumor cells, they penetrate the wall of a neighboring blood vessel, और उसकी wall के अंदर जब ये जाते हैं, this process is known as intravasation. And when they intravasate, it means that they have entered the lumen of the blood vessel. Here the tumor cells, they tend to aggregate, they form clusters which are known as tumor emboli. They bind to one another, they bind to platelets, they bind to coagulation factors, and they produce small balls of cells. Now these balls of cells, then they go and through the flowing bloodstream, they go via the flow of blood, and they go and they stop at some site, stick to the wall of the blood vessel, and then they move out. पहले इंट्रावजेट हुए थे, अब ये इग्रेस कर रहे हैं, अब ये एक्स्ट्रावजेट हो रहे हैं. ब्लड वेसल की वॉल में से बाहर निकल के कोई भी जगह जो इनको पसंद आ रही है, जहां पे इनके कॉरेस्पॉन्डिंग लाइगेंड्स या रिसेप्टर्स हैं, उधर जाके ब्लड वेसल से निकल के बाहर जाके किसी सॉफ्ट टिश्यू में जाके डिपॉजिट. Arrest and extravasation of the tumor cells at distant sites, which is known as metastasis, involves again adhesion of the tumor cells to the wall of the blood vessel, that is to the endothelium, and then egress through the endothelial line. Now, this process also involves adhesion molecules, especially CD44, which is expressed on the normal T. Now, this is a very important diagram. This is the original clone of malignant cells. This was the original mutated cell. Now, this is the primary tumor. ये सिंगल सेल था, ये अब मल्टीप्लाई करके प्राइमरी ट्यूमर बना. अब ये प्राइमरी ट्यूमर यहाँ पे ग्रो कर. अब ये आप देखो कि इट इज इस बेसमेंट मेम्ब्रेन को तोड़ के this has come into the extracellular matrix. This has adhered to, and there is invasion. This is the basement membrane. This is the basement membrane of the extracellular matrix. Now, this is the extracellular matrix. This one cell has broken the basement membrane. The modified basement membrane, which has been broken down by the matrix metalloproteinases, इसको break करके आया है into the extracellular matrix. Now, this cell is multiplying. It has produced another clone of cells. And this is a blood vessel, ये जो red one. अब this clone of cells, malignant clone of cells, is now penetrating the basement membrane of a nearby blood vessel. उसकी basement membrane को तोड़ा है, उसके endothelial cells को तोड़ के अब it has entered into the lumen of the blood vessel. And here they have come in contact with the inflammatory cells, these yellow platelets, उनके साथ मिलके platelets वगैरह के साथ मिलके they have formed a tumor embolus. Now this tumor embolus, it is traveling along with the flow of blood, and now it is again penetrating out of the wall of the blood vessel. यहाँ पे it has entered into the wall of the blood vessel. It has grown in the lumen, forming a tumor, and now it is going out again. It is breaking the basement membrane and going out again, and this is where it is forming a metastatic nodule. So intravasation भी हुई है, extravasation. That's all. एंजियोजेनेसिस हम बाद में कल करते. ये बेटा ये स्टॉप कर दो लेक्चर.